Hi, I'm Destiny. I'm a pediatric nurse and I have been for about a year now. I work on a GI and neuro unit. I love my job and adore the population I get the privilege to work with, so very excited about doing that, and I hope to become a PICU nurse one day in the future, hopefully. My personal philosophy of nursing is to treat my patients with the utmost compassion. I want to ensure my patients and their families that they feel comfortable, safe, and trust my care that I am providing to them. Of course, being a knowledgeable nurse is important, but providing care such as ADLs, medications, and other nursing skills, but without the foundation of compassion, patient care wouldn't be the same. Several examples of my current practice demonstrate this philosophy, but some instances that stand out to me were a time when I had a patient. They're 7 years old, 8 years old, and they're scared to move their arm where they had their IV placed because they thought there was still a needle in their arm. So I went and got the catheter, like the actual thing that you, like the whole catheter set, and then I showed them that there is a needle when you first get poked and that's why it hurts, but after the needle is removed, once we find the right spot for the IV, there's only a bendy straw left in the skin. So I actually gave them just the bendy straw catheter piece so they could play with it and see what it feels like, so they know that they can bend their arm and they can still do the things that they love to do while they're getting their treatment. Another time was when I had to place an NG in a 6-year-old. Prior to placing the tube, I got an actual NG tube, kind of like when I got the IV, and I explained to him exactly what I was going to do before anything even happened. I told him that it's kind of like a bendy spaghetti noodle that's going to go into their nose, and then what I really need him to focus on is drinking lots of water. And if he could focus on doing that job for me, that we would get everything done quick, fast, and easy, and it's not as scary as he think it would be. And usually when we explain the task to the parents and families in the terms that the patient can fully understand, it makes them feel more comfortable about exactly what's going to happen to them, which is kind of going back to what my philosophy of nursing is, making sure that my patients are safe, comfortable, and trust the care that I'm going to provide for them. Not only does it save them from a very traumatic experience that they're going to go through unknowingly, but when explained in terms that they can actually understand, like the IV catheter being a bendy straw, or letting them have a job while they're getting like a procedure done, like placing the NG, it helps them create a sense of autonomy and control in the situation that they're in, because in the hospital, there's not really that much control. In pediatrics, we have a group called ChildLife who provide explanation and resources to patients and families, kind of like what I described in my examples. But since I'm on night shift, it's kind of my job to get that done for them, since ChildLife's usually not around on night shift. Regardless, they're a crucial part of healthcare team. In an article from the American Academy of Pediatrics titled Child Life Services, they explain that ChildLife's goal is to enhance coping. They are there to teach the child coping strategies for adjusting to a life-changing injury or dealing with impending death, offering non-pharmacological pain management techniques, and communicating the child's development and individual needs, such as favorite toys, shows, distractions, to us and also to the families to help them get the procedure that they need done. Regardless of who performs this type of care, it is crucial in pediatrics to ensure that patients are involved in their own care and feel safe. It almost always provides better outcomes, which is why whether ChildLife is available or not, I implement these ideas into my own nursing practice to achieve and demonstrate my philosophy of nursing. Since I have only ever been a pediatric nurse, what is something you guys do in the adult world to prepare your patients for procedures? Or how do you create a trusting and safe environment with your patients? Thanks for watching.